Hi, I'm Dr. Kim Rain of the School of Public Health at the University of Alberta. I've been researching food environments for over a decade now, and I want to talk to you today about how food matters for communities. This is Module 1 of our Learning Module series, and it's an overview of benchmarking food environments or an overview of how to collect data on your own community and learn how to make changes to make healthier food environments in your community. This is based on work that has been going on for the past 7 years with a nutrition report card on food environments with children and youth. We've done this at both a provincial level and we've worked with local communities to collect local data. And all of that work has informed this learning module series. Why do healthy food environments even matter for communities? Well, first of all, we do know that dietary risks are one of the leading behavioral causes of death and disease premature in Canada, and it's second only to tobacco use. And diet is not really just a matter of personal choice. It's dependent on what's around you. So, for example, if you go to a recreation facility to be physically active and then you come out and you're thirsty, but the only beverages available to you are pop or sports drinks, you may be getting more sugar than you really need. So, you really don't have a choice in that case if the food environment isn't providing you with what you need. We also know that communities or municipalities have a strong influence on the diet of their residents. Just like tobacco use, we know that through the tobacco reduction movement, that municipalities who put in bylaws around not smoking in public places, things that we take for granted now, though, those types of changes really led to the decrease in smoking that we've seen over the last 30 years. And we are at a point now where we need to start thinking about the same type of approach for diet. As I mentioned, diet is one of the leading behavioral causes of early death in Canada. And as of 2019, in a large study looking at worldwide rates of disease in Canada, tobacco was number one and dietary risk was number two. And the dietary risks influence things like cardiovascular disease, cancers, and diabetes. So even higher than alcohol use, low physical activity, diet is right up there. And in terms of the food environments, we have been measuring food environments for, as I said, around a decade. And this is just a report that was written for Health Canada early in the days of collecting data on food environments. And we know that food environments shape the availability, the affordability, and the social acceptability of food and nutrition choices. And I put choices in scare quotes there because of the idea that I mentioned before, that we really sometimes don't have a choice. We're very much limited by what's available to us in our environment. There's also a growing body of research on food environments that shows there's an association between food environments and diet-related outcomes. And I'll share some of that with you as we go along. So the idea of benchmarking is really to get an idea of where we are so we can monitor over time how things are changing. So we started benchmarking with the development of a nutrition report card on food environments to really provide an assessment of how current environments and policies support or create barriers to improving children and youth's eating practices, and also to increase awareness of the public, practitioners, and policymakers of the relevance of food environments for health promotion. Just to give you a little bit of history, as I mentioned, we've been doing this for a while now. The first nutrition report card was released in 2015. We were really inspired by the Participation Physical Activity report card, which had about 10 years on us. They started about 10 years earlier and started these annual report cards reporting on what were the issues with kids being physically active in Canada? And so we were inspired by this and thought we need something around food and nutrition and diet. And so this is a publication that we talk about the process of developing the the nutrition report card, and we had people from the participation physical activity report card on our committee that helped us to develop it so we could learn from their experiences. So let me talk a little bit about the food environment because sometimes it can be really confusing. What do you mean by a food environment, you know? So there's 5 domains of a food environment. And those talk about, for example, the physical environment, which is what is available to us. So food that's available in schools, in recreation centers, even in our neighborhoods. Then there's the communication environment. Those are what are the messages that we hear. It could be advertisements. But in a local community setting, it could be things like advertisements in a hockey arena or in schools. Then there's the economic environment, which is really about what are the costs. So things like how much does it cost to purchase a healthy diet in a local community? And can people afford it? And then the social environment is around the attitudes and beliefs. And we look there at things like, is our school curriculum stigmatizing? Do we have free access to breastfeeding? And is that supported in the community? And so those are the pieces around the food environment. And all of those are located within this political environment, which is what are the rules? Are there policies in place that actually say we should have healthy food in school? We should have healthy food in recreation facilities. So that is what constitutes a food environment. And our report card assesses it in all 5 levels. In terms of municipalities, this is just an example from a report card that we did back in 2018. And, so we can collect data around what's going on in schools. Are there convenience stores close to schools? What about what's happening in the rec centers? What about transportation? What about grocery stores? What's happening in public buildings, fast food restaurants? Is there advertising available? And all of this constitutes what's happening in a community and are all indicators that can be collected locally. This is just to give you an example of some data that we've collected previously. This is the food available in a recreation facility. Now we use a stoplight signal here to give you an idea. Foods that are we consider choose least often. We don't, they're sort of like treat foods. We wouldn't want people consuming these every day, are indicated in the red. Foods that are healthy, the foods that we say are choose most often, things like fruits and vegetables and low-fat dairy, things like lean proteins and whole grains, those are in the green. And then the choose sometimes are the ones that are kind of somewhere in the middle, things like your granola bars and maybe your flavored milks and yogurts and stuff. And so those are the yellow. So that's how we're looking. And if you just take one quick look at this page, you can clearly see that the food available in these recreation centers, whether it be in a concession or whether it be packaged products at a concession or whether it be in vending machines, by and large, the majority of the foods offered in these recreation centers are choose least often. They're the unhealthy options. It's not really the message that we want to give to people who are trying to be physically active at these centers. So some of the things that we can recommend around municipal recreation is, perhaps the recreation center could actually mandate that the food that's available use vending contracts and follow the guidelines offered in, for example, the Alberta Nutrition Guidelines for Children and Youth. So that is one possibility. And, sometimes recreation facilities have great places to prepare food. Sometimes they don't. But if they do, maybe they could even partner with the local school and be a place where healthy food could be prepared for schools. We do know that in public facilities, that there's a lot of evidence that shows if public facilities actually take the time to determine, we're using publicly funded money here, we're serving the public. Why are we getting into and selling in our places things that don't support the health of our community? So we do know that there's a lot of evidence that encourages all publicly funded institutions to implement these healthy food procurement policies as part of a broader vision of food policy that promotes health, environmental sustainability, and local economies. So it's not just the recreation centers or the schools, it could be the hospitals, could be any public buildings whatsoever. We actually have been collecting evidence from other locations, sometimes local, for example, in the city of St. Albert, but from locations across Canada around what other communities have done. City of Hamilton has adopted a corporate food and beverage policy. City of New Westminster has a healthy food service policy. And then, as I mentioned, City of St. Albert has requests for proposals when they're putting out for tender um, food vendors for their public buildings. They ensure that they are able to provide healthy choices. So we provide, as people can see where their community fits, there are some resources that can help them understand how other places have made changes and things that they could learn about too. Another thing that happens that is within the domain of communities or municipalities is zoning. So I'm sure everyone's heard of zoning. You zone it for residential or for commercial, but there's also ways that we could improve the food environment through zoning. So, for example, thinking about creating a safe space around schools, a 500-meter walk shed, for example, where there's no convenience stores or fast food outlets, so that kids aren't exposed on their walk to school to or home to those types of unhealthy products. And we know from Canadian research that both the where recreation facilities are placed and where unhealthy food vendors are placed has an influence on things like kids' obesity levels and their body mass index. So we know that when there are fast food outlets within a 500-meter walk shed of schools, that's associated with higher levels of overweight and obesity. Just to give you an example of some data that we collected in the Alberta context, and these are two of our two largest cities. Only, in Calgary, almost 32%, and in Edmonton, only 27% of schools had absolutely no unhealthy food vendors within 500 meters. The same amount, so 30%, had 5 or more. So the majority of schools do have unhealthy food vendors located nearby. And so these are the types of things that, if your city is looking at their zoning requirements, might want to think about what's happening around the schools. And again, we have some resources on our website with the Alberta Policy Coalition for Chronic Diseases, the School Zone and Nutrition. This has been developed in the province of Quebec, but thinking about creating that healthy zone around schools. And, even things like drive-throughs, and that has an influence on our food consumption, as well as things like environmental impact with all of the idling. So these are things that communities can think about when making zoning decisions. So I mentioned that we've been working for 3 or 4 years now with some local communities to develop community report cards. And what we've done traditionally in the past is we've partnered with the local health system, so often with Alberta Health Services. We've worked with community health facilitators as our sort of key contact person, or community dietitians. And these communities that have been interested in working with us on developing their community report cards have seen healthy food and healthy eating as a priority for action to improve their local health. What we've done traditionally is we've had face-to-face community orientation workshops that, does some of what I'm telling you about today, talking about what food environments and what does it mean and why are they important, and talking about settings that you can collect local data in. And this is all going to come to be much more clear as you work through the subsequent modules, and thinking about which particular settings and indicators you want to collect. What we've done in the past is we've had an automated sort of online questionnaire that people use their smartphones or tablets to answer this questionnaire with things like what food's available in the schools, in the recreation facilities, in public buildings, whether there are nutrition policies, thinking again about that political environment. Are there nutrition policies that encourage a certain type of food being offered in, for example, schools? We've asked in the past, we've asked people to capture the menus and pictures of vending machines. So, and then send it off to us at the university. And then what we've done is that we've analyzed that, and counted up the choose sometimes, choose most often, and choose least often foods, and sent a report back to the community and worked closely with them in coming up with recommendations. What we're working through now is the development of a new app, and the data will be collected in a very similar way. But because we've had several years of working, we know what foods are typically in vending machines. And so instead of taking a picture and sending it back to someone else to look at it, there'll be sort of radio buttons or drop down menus of the foods that you are counting in those vending machines. And then we also have predetermined where those foods fit in that traffic light system. And so when you count the unhealthy foods, the app will be able to help you keep track of the numbers. And then a report will be generated using that stoplight system. So, this is an example of a hockey arena menu in a small town. And so, basically they took a picture of it and sent it back to us. And we said, okay, they got lots of burgers. Those are, in the choose sometimes area. Then they've got the fries and the poutine. That's the choose least often, that type of thing. There's the chips and the candy bars and the candy bags. Again, the choose least often. So we were able to code those types of things. In the case of the app, instead of taking a picture, or I guess you could take a picture and then go through and count it up. But you would go through your list and say, okay, there's a classic burger, burger, 3 burgers. you know, Here's the Gatorade. Here's the juice, here's the chocolate milk, so you would actually count up the numbers of options and choose from the menu that is on the app as to what is available. Some of the other areas that communities choose to look at is children's cereals. And so, counting up the number of children's cereals that have higher or lower sugar. And again, we've been able to go through and classify most of the common children's cereals as healthy or less healthy. Again, here's another example of a vending machine. This one is actually in a hospital, which is kind of disturbing. But so instead of sending a picture with the app, you would say, okay, there's 1, 2, 3, 4, 5, 6, 7, 8 Reese's Pieces. There's 1, 2, 3, 4, 5, 6 potato chips and 1 Cheesies. So that will, well, basically 100% of those foods would be choose least often, but it's a systematic way of being able to record that. The communities that we've worked with have really enthusiastically participated in collecting local data, and they've really become appreciative of the role of food environments in shaping choices. And things that they may have taken for granted before or hadn't really even thought about before, um, come to light as potential ways to improve the food environment for children and youth locally. It also localizes that power of policy change. So, in local communities, it's possible to say, to go into a local business, into a local grocery store and say, hey, could you stock more healthy children's cereals? Or, could you remove the candy from the checkout area? And more often than not, local businesses are interested in meeting the needs of local communities, so they will listen to the recommendations. Also, schools might. We've had in Alberta anyway. We've had nutrition guidelines for children and youth for over a decade now, but they have never been mandatory at the provincial level. But some local schools have chosen to make them mandatory because they believe in the importance of healthy food environments. And so sometimes when a school actually looks at what they're offering, they sort of say, oh, we're actually not doing as well as I thought we were, and maybe we should have a policy and only offer the healthier products. What we anticipate happening with this app is that you will get a report that comes back looking something like this, and so again, we're using the traffic light system. The green being healthy, the yellow we could do a little better, and the red not doing very well right now. So it could be broken down by particular school. It could be broken down by childcare settings. It really is up to the community to determine where do they think is a priority for us to assess the food environment in this community. So this is the type of output you would get, and it would make it possible for you to go back, say, for example, in a year's time, after you've gotten a committee together to try to make some changes to see if you've upped the greens and decreased the reds. So there's a benchmark that you started with, and it's have we improved the grade over time. So that is just an introduction to collecting data at the local level and why food environments are important. There are modules coming up that get into the nitty gritty about how to actually do this. I do just want to thank the funders who made the report cards possible. And I also want to indicate that, on the Alberta Policy Coalition for Chronic Disease Prevention's website, we have the report cards right back to 2015. So people are able to go in there and take a look and see what kind of scores we were giving, how Alberta was doing. And hopefully this will provide you with some resources and get you excited about creating a healthier food environment in your community. Thank you very much.